Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. We're entering into spring, and so we thought we'd do some really fun, some webinars on things to think about with spring. We did Ida Hammer and talked about changes in feet, and today Dr. Anna Marie Hancock is going to talk about seasonal health, spring health. So we're so excited about this. It's so timely. Thank you, Anna Marie. Thank you so much for joining me today.
Sure. Thanks for having me. We thought what we'd probably try to cover today is maybe talk a little bit about vaccines, since everybody's getting their spring vaccines and wellness exams done. And then I kind of put together a little bit of stuff on nutrition and maybe laminitis risks for those of you guys that are worried about what you should be feeding and, what do you need to be worried about as this grass comes up. So that's what I was going to start with, if that's
awesome. It's perfect. Yeah, because those are the big issues right now, right?
Right. Yeah. So
we make
please feel free to ask questions as we go too. Definitely. I want this to be interactive. So then I share my screen and I can do my PowerPoint. Is that right?
You're co-host now.
All right. So let me do that one. All right. Can you guys see that PowerPoint screen?
Yep.
All right.
Yep. If you just start the PowerPoint, then it'll go big and then it'll be even easier.
And you guys are all set. Okay. So I thought we'd start by talking about vaccination. A lot of you guys may already have your spring vaccines, but if you don't have them yet, then this might be a chance for us to talk about it and see if there's anything that you maybe have questions about, and we'll go from there. So I wanted to give you guys a more holistic, conventional approach on vaccination, and maybe give you some questions that you can take home and talk to your own veterinarian about. Maybe open up a dialogue instead of just, I hear a lot of people say things like, well, they're the authority and they know what I'm supposed to get, and so that's what I've been doing. But this might kind of give you some more information so that you can make some decisions together on your horse's health. So why do we vaccinate? So the main reason we vaccinate, obviously the big one is some diseases are deadly. So if your horse can die from a disease, then it's a really good reason to vaccinate against it. So examples of diseases that can be fatal are Eastern encephalitis, Western encephalitis, Venezuelan encephalitis, and then rabies, tetanus, and maybe West Nile, although it seems to be less likely to cause death than it used to. But those are certainly the big ones. If you're gonna get a vaccine and you only want to get one, you would want something that was going to cover some of those diseases that your horse could die from. I used to live in North Carolina by the ocean, and we saw Eastern encephalitis cases every year, and there's nothing you can do. They're always fatal, and they're usually not vaccinated at all. So it certainly made it very clear to me that the vaccine for Eastern encephalitis prevents death, just because we saw it every year down there. And I think that's true along the coast, all the way up the East Coast.
So what's the difference between Eastern, Western, and Venezuelan?
I think it's the location, as far as where do they have it, and which mosquitoes are needed to transmit it. So we see Eastern encephalitis all up and down the Atlantic seaboard, all the way up to Massachusetts and New England, and it's definitely all the way around the Gulf of Mexico. Western encephalitis would be something you would see in the Western states. I've never seen it. I think it's pretty rare, but it's a possibility. And then Venezuelan seems to be more like south of the very southern part of Florida, the southern part of Texas, and then down into Mexico and Central America. So not a risk for most of us, but if you lived in southern Texas or southern Florida, it might be something that you need to worry about. It has to do with, you have to have a certain climate that includes birds plus 2 different species of mosquito in order for the encephalitis virus to, get all of its life cycle taken care of and to have something that can then be infective to the horse. So that's why we only see it usually in the summer when all those mosquitoes and birds are all living in harmony together, and then passing the bugs on to the horses.
And West Nile, it's, correct me if I'm wrong, but it seemed like on the East Coast when we had West Nile, it wasn't too bad, but horses in Colorado really suffered. So is it possible that our horses on the East Coast have had some sort of a mild exposure to it, have a little more resistance? But I know it, like in Colorado, it was really bad. when they wound up with West Nile.
But I think it kind of came through in waves. So that first year that it hit the East Coast, it was bad. And then it seemed like by the second year, most of them had some sort of herd immunity. And I think the same was true as it came across the country. The first year that as it went west, that first year it came to an area, it was really bad. I would bet that there are a lot of people in Colorado that don't have to worry about mosquitoes a whole lot, don't have to worry about bugs, and I know we used to do very minimal vaccination, in Colorado, you don't have to vaccinate for rabies in Colorado because they don't have it. So you probably saw more cases because there were probably people who were very likely to spread out their vaccines more, that kind of thing. I think that's probably why they would have seen it more.
Okay.
So that's your first reason why to vaccinate. And then the second reason would be that it could be very costly to treat. So when you weigh the economics, is it a better option financially to vaccinate or to have to treat the disease? So the main ones I think of with that are botulism and Potomac horse fever, as far as something that maybe it would be different. So with botulism, which is something we see in Virginia, and they also see a lot in Kentucky, it has to do with the bacteria living in moldy hay. So we have a very damp environment in Virginia, and so that's why we see a lot of botulism. And so if they were to ingest the bacteria and get botulism, what I've been told, this was a couple of years ago now, but what they were saying is it would take about $20,000 to treat. And you can't really know if they're going to make it until you spend the money to try to treat them. So you can't walk in the door and say, I only want to spend $1,000 and let's see if they're going to get better. And then we'll decide if we're going to treat them the rest of the way. You kind of have to commit to that whole 2 weeks of treatment and then see if they get better. So, a $20 vaccine that would prevent $20,000, worth of a cost to treat is kind of how you have to look at that one. Economically, it might make sense to vaccinate.
Well, and I lost my horse to one of my horses to botulism. It was in the summertime grazing in a field with no hay.
Right? Like, how does that happen?
At Joyce's, he was at Joyce's and he grazed nose to nose with the other horse. They literally were like 2 peas in a pod. He dies, the other one's fine. And they hadn't heard about botulism in Rappahannock County in horses at that point when that happened.
I think it just has to do with the molds and the spores and the dampness, and it's just endemic. I know we had a client who lost a horse with she was just feeding square bales and they didn't look like there were any problems. And usually you think about it with brown bales, so you're getting heat in the middle of the bale and that's what's causing it. But yeah, I just think it's one that, especially in our area, is probably worth vaccinating for.
And is Potomac horse fever now it's got the name Potomac because that's where that originated, right? But is it everywhere? What is the demographic?
You have to have snails and you have to have moisture. So you usually have to have somewhere with standing water and snails, and the horses have to be ingesting their grass, near those damp areas. So it seems to be most common in our area, like right along the Potomac River and between Maryland and Virginia. And then there's clusters of it, certainly up and down the East Coast. And I hear about it in Wisconsin and, Michigan, Minnesota. The only area of the country that I know of that actually thinks the vaccine is effective is our area. So when all the veterinarians get online and they start talking about Potomac horse fever vaccine, you get a very divisive population, and it's only in Northern Virginia and Maryland that cares about Potomac horse fever vaccine. And half of them think it's the best thing they've ever given in it, and it saves horses, and the other half have never given it and don't think it does anything. And they're in the exact same location. So it makes it really hard to judge whether that vaccine is effective, because you have people that are on, the two separate sides there. I think what we do know is that if it does work, it maybe lasts 2 or 3 months. And it seems to be at least not likely to cause adverse reactions, so relatively safe, maybe not effective, or if effective, only effective for a very short period of time. So I always try to time it so that if I'm going to give Potomac horse fever, I give it in June, because we only see, cases in July and August. So giving a Potomac horse fever vaccine in December is a waste of a vaccine. You're giving it at a time of year where you're not going to see Potomac horse fever, and it's not going to last until the time period when they would actually be exposed to the disease. So,
and what's the, I mean, I started running a riding school, and the first thing that happened is first came down with Potomac horse fever. It was October in Connecticut. Believe me, that was a drama. It was quite a number of years ago, but in terms of cost of treating a horse that has Potomac, what are the chances of it surviving, and what are the costs for that roughly now?
So it depends on how bad they get, right? So the big risk with Potomac is if they get the full-blown, high fevers and endotoxemia and the colitis, they can actually end up with, they can get laminitis that causes sinking and rotation in all 4 feet. Those are the really bad ones. And oftentimes with those horses, no matter what you do, you can't save them. So if the theory with the vaccine was maybe it would minimize some of those symptoms, and if you got just a fever and maybe a low-grade colitis or diarrhea that you could treat and get them through it without getting that laminitic problem, and then maybe that would be worth it. So I think that's why the people that do vaccinate is they feel that they're not seeing those terrible cases anymore, like they saw 20 to 30 years ago, where we did have the horses that like they just fell out of their feet. It was awful.
Yeah.
So I think that that's why the vaccine is important to the people it is. And I just think we see less of those systemic cases that are so bad now. We see a lot more cases where the horse has a high fever and we go out that day and we start them on, IV tetracyclines, and they improve. And so, they may have had Potomac, they may have had something else. We just got them through with the antibiotics, and we're not seeing all the symptomology that we used to see with those early Potomac horse fever cases.
Yeah. It was the most painful horse I'd ever seen.
Yeah, it was pretty terrible. I saw one when I was in vet school. I went out to New Jersey and did an externship, and we had one of those cases where, it seemed fine, had a really high fever. We were doing everything we could, antibiotics, steroids, like anything they could do to try to decrease the inflammation. And even with all of that, the horse ended up, foundering on all 4 feet. It was pretty awful. So yeah, that would be the reason to vaccinate for Potomac. And then the other one I kind of threw in there is the Rhino Pneumonitis cases that we see. So we'll touch on this a little bit as we go through it too, but I put that in there, as a neurologic case of Rhino Pneumonitis, but we don't actually have a vaccine for the neurologic portion of the EHV, viruses. So we have vaccines that will protect against the respiratory forms, but we don't have a vaccine for the neurologic forms.
And are they two distinct different viruses?
There's different strains. And so I think what we have is we have vaccines that seem to work really well against the respiratory strains that are most common. And those seem to change all the time, but we just haven't found a way to protect against the ones that go from the respiratory form into neurologic. So it can happen that you can have 2 horses with the same strain, and one gets respiratory symptoms and one gets neurologic symptoms.
And we don't really understand that mechanism.
It's weird, right?
Yeah.
Yeah. So I think that's what's so scary about it. And so I think a lot of people think that when they vaccinate and do their flu rhino shot, that they're protecting their horse against that neurologic form, but they're not. They're protecting against the respiratory form. And hopefully when you do that, you're minimizing shedding, which is what I have on number 3. So the reason that you vaccinate and do your flu rhino shot, or you do your Strangles shot, in a lot of cases is to minimize shedding and prevent those diseases from spreading when you go to shows, or, if you have a bunch of people in and out of your facility. So especially with the influenza and the rhino vaccine, we're hoping that we can maybe make the disease a little less, lessen the symptomology, make it so they're not quite as sick. And the real hope with those vaccines is to prevent shedding from horse to horse. So if you had rhino or flu show up in a horse, it's much less likely to be able to spread it to everyone at the show that it went to, maybe minimize that risk to the rest of the people that are there. So, and I put Strangles down here too, as far as when can you vaccinate for strangles? There's a lot of questions about the strangles vaccine and whether there are some risks associated with vaccinating for strangles. So if your horse has an antibody titer that's high to the strep equi bacteria that is strangles and you vaccinate, you can cause this huge autoimmune response called purpura hemorrhagica. And it's a full-blown, the whole body kind of can shut down. You can have organ damage and failure. You can have all kinds of bad things happen. So a lot of us are cautious in how we vaccinate for strangles, because strangles is one of those diseases that's gross and it's disgusting and there's snot everywhere. But very rarely does it, actually kill a horse. It's just gross, not fun to live with. Yeah.
And are the ones in the number 3 category, are there management practices that we can do that kind of mitigate that to kind of, like, it's strangles everywhere and it's just a question of a horse gets strangles, or
yeah, the ones in the number 3 category are absolutely those diseases that you could probably do a lot of biosecurity containment of and not vaccinate, if you're careful. So if you never share water buckets when you go other places, right? And you make sure that you keep your stuff clean and you're not using other people's tack or brushes or, sharing buckets and sharing, those sorts of things, I think that you can minimize the risk to your own horse and you can minimize that shedding, and contamination risk with others. So it's just like COVID, if you could keep 6 feet or 12 feet between you and everyone else, you could probably minimize a lot of the chances of getting those diseases. Yeah. So I think we've all gotten pretty skilled at biosecurity.
Yeah.
So I think that one a lot of us can understand. Yeah. And then the last category is kind of some of these odd vaccines that, we're not sure if they're helping and we don't have a lot of data necessarily to support them, but they're out there and we use them in some cases. So the ones I listed on there's a Lyme vaccine that a lot of people use in the horse world, and it's actually a dog vaccine that there were a couple of studies that came out maybe about 8 to 10 years ago showing that it had maybe some efficacy. So it's kind of off label, but a lot of people use it. And then EVA is it's a sexually transmitted disease that there were some problems in Texas and Oklahoma with some quarter horses a few years back where they had a couple of stallions that came up positive and can be spread to mares and cause a huge inflammatory reaction. And, so a lot of the quarter horse studs for a while, they were vaccinating them all to protect them and, getting mares vaccinated before they were exposed to a possibly positive stallion. So that one's usually specifically in the repro world. And then that last one is lepto. And we do vaccinate for leptospirosis if you have a facility that has it, because it's usually something that's water contamination, groundwater contamination. If you have stagnant pools and you have wild animals coming through them, you might have a source, and it can cause uveitis. So if you knew you had it on a facility and you were trying to prevent horses that didn't have it from getting it, you can vaccinate the ones that don't have it, but you have to check titers before you vaccinate, because if you give the vaccine to a horse with a high titer, you can cause that horse to get uveitis and blindness. So it's one you have to be careful with.
Yeah, tricky.
So those are my 4 categories that we're going to kind of go into more in depth, but just to kind of start and make you think about those. So I just wanted to kind of review. So, for what you guys are getting from your veterinarians, a lot of veterinary offices offer wellness packages, right? So this is a great way for a veterinary practice to help them stay afloat throughout the whole year. So what they have you do is they have you pay a little bit, quarterly, and then they offer you a program that includes usually wellness exams and maybe dentistry and, your vaccines and your Coggins, and it's all in one. So they know ahead of time that this is what they need to plan for inventory wise. This is how many appointments they're going to have, so it helps the veterinarians kind of plan ahead. And it can be, a great way to make sure you're kind of getting all encompassing care, but not all animals need all of those things. So I think, it's a great way for a veterinary practice to offer something that is like I'm saying there, gold standard, which is what everybody in veterinary medicine likes to talk about, is the gold standard approach. Are we doing everything we can for that particular horse? But I think that it is important for you guys to think about, maybe I don't need all of those vaccines that are in that package. Is there a way that I can make some discussion, talk to my veterinarian and come up with maybe which ones I do need, which ones I don't need, what is my risk, what am I going to be exposed to, and then make a decision on, the health of your horse. Can they handle all the vaccines? Like if you had a horse that had laminitis and was actively stressed and uncomfortable, I wouldn't be vaccinating them at all right then. I'd be skipping that set. They're probably older. They've probably been vaccinated multiple times. They probably have immunity. They don't need this stress, on them at that point in time. They're trying to deal with something. So just kind of having that ability to talk about that and think about it is, I think, important. So I just wanted to kind of bring this up and have you guys think about it. I think that the AAP is starting to talk about that. So that sheet that's on the side, I think I put a link to it on the webinar. So if you guys wanted to use it, you can, but I think it's a really great way that a person could, kind of look at this sheet and bring it with you to your exam. And it gives a lot of information to the veterinarians, that they can make a lot of decisions for you based on what's on there. So when you look at what's on this sheet, like age is really important. So older horses have been vaccinated a lot. They probably have adequate titers to everything. So they may or may not need to have everything. But if you have a horse that's only a year old, they're not going to have very good titers yet. They need to be boosted. You can't afford to not give them vaccines because they're not going to have enough immunity already. So if your mare is pregnant, there are other vaccines that get added while they're pregnant to prevent abortion. We have an equine Rhino Pneumonitis vaccine specifically to prevent abortion that's really effective. So that might be something, like we were talking about. There are specific vaccines depending on risks from the stallion you're breeding to. Do they have anything else going on? So if your horse has Cushing's or metabolic syndrome or is very sick, then maybe you want to minimize how many vaccines they get because it could be a health risk for them. And then I like the one about where they live, right? So if they live alone or if they're with other horses, or are the horses on the property ever leaving the property, or are their horses coming in and out all the time? What's the risk of new stuff coming in? I think that one's really important. And then, like we were talking about, knowing whether you have standing water or creeks, like we were talking about with Potomac horse fever, or lepto, do you know that you have a rabid raccoon problem on your property? If you know that, then maybe rabies is more important, than if you don't have something like that. So just trying to understand all of that. It says potential to injure themselves. I think that's kind of a clue to tetanus, right? We know that tetanus lives in the horse's GI tract. And so it's endemic, it's everywhere in the horse's environment. So if they live on a property that has a lot of places that they could get punctures and injuries, then tetanus might be something that you booster more often because it's a bigger risk, from all of those wounds. And so then, on the other side, what are they exposed to? If they live in Florida and there are mosquitoes year round, oftentimes they vaccinate 2 or 3 times a year for those encephalitis diseases because the mosquitoes are there all the time and they want to protect those horses. So that would be a good reason to know that. If you have ticks everywhere, then maybe you talk about the Lyme vaccine. And then where are you going? So if you live in Colorado and you're never leaving the state, you never need to vaccinate for rabies. There's no terrestrial rabies in Colorado. But if you live in, if you're planning on traveling to, Virginia or Florida or Texas, you better be vaccinating for rabies because they have that there.
How is it possible that Colorado doesn't have rabies?
I don't remember why. I went to school there, and so that's why I happen to know that. But I think it's because I've been trying to think if it has something to do with the bats. There's some reason why they don't have, or maybe they only have aerosolized rabies in bats and they don't have terrestrial rabies. but it's just not a risk there. So, I mean, it's like how they don't have, because it's so cold and it snows, you can, skip the heartworm and the, flea medicine for part of the year because you don't have to worry about them. So it's just a really great bug-free zone. It's really nice.
Yeah. I mean, there are places with mosquitoes where they have lakes and things like that. Cause around Fort Collins, I can remember that they had an outbreak. I think it was Fort Collins. Rhonda would know, of West Nile. But for the rest of the state, pretty much. Yeah. By the way, I popped the PDFs. Hopefully people can click on them. I popped the PDFs and the links into the chat that Dr. Hancock sent me, and we will post it when we post the webinar. We'll make sure those links are on Facebook too. She gave us great resources, including this chart.
Yeah. So, where are you going to be exposed, right? Out of state, and then what does your horse eat? So if your horse is eating haylage or silage, like it's talking about down there, that would be a huge botulism risk, right? If you're going to feed anything like that, you better be vaccinating for botulism. So looking at what you're feeding would be something. And then, do you have any concerns about, paying for vaccines or how safe they are? There's always a horse, at every barn that always has a vaccine reaction. Like there's one horse, that you have to give Banamine to if you're going to vaccinate because he's going to colic or he's going to have fever or something like that. So, thinking about those horses, do they actually need that vaccine? And that's what we're going to talk about is, do they really need that? So what I think would be maybe a better way to approach these wellness packages is, wouldn't it be great if instead of having a package that already told you that you were going to vaccinate for all of the diseases that we can vaccinate for, if it was more of a consultation where you get enough time with your vet that they actually have time to stop and talk with you and discuss all of these health risks and your options, and look at the horse move and look at the horse's teeth and talk about nutrition and talk about saddle fit. I think that would be a much better way to do a wellness package than to just be like, our wellness package offers, these 6 vaccines in the spring and these 5 vaccines in the fall and a Coggins, and, we'll be in and out when you're not there. I think this would be a much better way to look at it. So I'm just kind of putting that out there for you guys to think about.
And like routine radiographs of the feet just to make sure everything's okay. I've started doing annual radiographs.
I think that would be a great thing to do. I love it when people let me do laterals and DPs, just so that we can keep an eye on what's going on and make sure the sole depth is staying nice. If you can get decent sole depth, you can prevent a whole lot of problems with the feet. So just kind of keeping an eye on that, which is really hard to maintain in the East Coast in the wet. So if you live out west, it's really easy to have nice sole depth, but I don't know if that's true in the Northwest where it's also damp, but anywhere that it's nice and dry, you can get these really nice hard feet. But for those of us that live in the damp, it can be really hard to keep sole depth and decent feet. So yeah, wouldn't that be great? I like that. Just I wanted to kind of talk about risk versus benefit and what we mean by that. So it's talking about, looking at the balance, right? So if there's a large disadvantage or a large advantage, and, talk about how do you make that decision? So you can kind of weigh things in 2 ways when you're looking at risk benefit analysis. And one of them is that collectivist, like, the option to do this is better for the whole if we all do it. So even though there might be, a slight decrease in benefits or a slight risk to the individual, getting everyone to go ahead and have this benefit is worthwhile. So we're going to take the risk to the individual over that. So I think that when you talk about that sort of principle with risk benefit, you're talking about the COVID vaccine, right? It's way better for us, as a society, to minimize the risk by vaccinating as many people as possible, although it may be a huge risk for some individuals in the population, right? So that's the theory behind that principle. And I think when we start talking about how do you choose to benefit your horse, we're looking more at this individualist principle, which is this option acceptable for the individual horse? Do the risks outweigh the benefits, or do the benefits outweigh the risks? Which is better? So, there are probably many more times where you're going to be dealing with an individual horse and making this decision than you are going to be making the decision based on the herd. But I mean, that's what we're looking at is it herd health or is it the individual horse? And for most of us, we don't have 100 horses living in a pasture together. We're making a decision based on the 1 or 2 that we own and that we love. So we're looking at that second principle. Okay, so what I'm going to talk about on these, we're going to kind of break down those diseases again, and we're going to talk about whether or not, how do you make the decision and do you have options besides vaccination? So the first ones we're going to talk about are like the ones that I said are the most deadly. So we have the encephalitis, Eastern, Western, or Venezuelan. Depending on your location in the country, you're going to have one of those that might be the most at risk for you. So unless you live in Texas or Florida, you're probably not vaccinating for Venezuelan, and you don't need to. You're just not going to be exposed. And for the rest of the country, you are at risk for Eastern or Western, and most of the vaccines contain both. So you're probably going to vaccinate from both. So the risk of an adverse reaction to the vaccines for encephalitis is pretty rare. Most of the vaccines have been around for a long, long time, and they're usually really safe. So I don't see as many vaccine reactions to the encephalitis vaccines. Most veterinarians have a favorite brand, and most of us have one that we think we see less reactions with. So for me, that's, I love the Merck vaccines, but everybody has their own that they think is the one that they haven't had reactions with. So I think that the risk of an adverse reaction is pretty minimal. Like we said, the disease itself can be 99% fatal. So I think that whether you should ever vaccinate or not, this one is that you should definitely vaccinate at some point in their life. It is protective, it's low risk. They should have some exposure to this vaccine in their life. The question is, can you test them to see if they have an adequate titer and see if they need to be revaccinated? So for Eastern, Western, and Venezuelan, you actually can do titers. They're available through the U.S. labs at Ames, Iowa. And we are pretty confident that if they have a titer of 1 to 100, that's protective. So there's another link. There's a set of documents that I put in my attachments that has to do with some guidelines that were put out by the AAP for the first time ever a year or 2 ago, where they've actually come out and given us some guidelines for titers and talked about what they think is appropriate. So if you are worried about vaccination and you're worried about overexposure for like that older horse that might have some disease processes that you don't think he needs the extra inflammation or the immune reaction that the vaccines would give, we have some data now that we can use to make these decisions. So testing for the titers for Eastern, Western, and Venezuelan, I usually test for that along with West Nile. It's all one blood tube that goes to Ames, Iowa, and I think it's about $100 to test for those 4 diseases.
So someone's asking what a titer means.
Oh, okay, so a titer is the natural level of antibody that is in the blood or that horse has to a specific disease. So what we can do is we can, based on that, we can make some assumptions, although it's not a 100% guarantee, but you can make some pretty good assumptions on whether or not that horse would be able to defend itself against a specific disease successfully. So if they have a certain level of antibody in the blood, we think that they would not get that disease if they were exposed. So that's what we're trying to say there. So when you measure the blood, you'll come back with one of 3 readings when you test for encephalitis. So you'll either get a negative, like there's no antibodies, or you'll get a 1 to 10, or you'll get a 1 to 100. So if I get a 1 to 100, it's a no-brainer for me. I assume that the horse is protected, and I am not worried about vaccinating them that year, that they should be fine for at least a year. And depending on their age and what I know of their vaccine history, I might say, okay, we can retest their titers in 2 years or, kind of see. So when you look at the guidelines, let me see if I can't pull, I think it's the last page of that article. They actually say that they think that the duration of immunity is at least a year. So I have pulled titers on my own horses, and they have been without vaccinations for multiple years now, like say probably at least 3 to 5, if not longer, and we still have adequate titers. I have a couple clients who choose to do titers instead of vaccinating every year. And I think we're at 9 years now, and they still have the same titers that they had when we started pulling them 9 years ago. So she hasn't had to vaccinate for 9 years because they're holding those titers.
How expensive are titers? Like if you wanted to do a titer versus do a vaccine?
And the titers are more expensive than vaccination, right? Because that vaccine is probably like, let's say $35 to $40, maybe a little more now, whereas the pulling the blood is like 100. So for some people, it's, they kind of balance out and they go, well, it's cheaper for me to vaccinate than it is for me to get the titer. So it depends on what is your risk benefit ratio. Like for you, is it an economic question? Is it a health question? Is it a, do you have a belief that you would like to minimize it? So I think everyone has to kind of make this decision on their own. But a lot of people don't talk about titers, which is why I want to kind of put it out there. You guys.
Oh yeah, no, I think it's a great discussion, and that's so. If you pull blood for titer, can you measure different things with the same blood sample? I mean, it's a $100 for a blood draw, and then different tests, or is each test then in addition to that?
Right. So the ones that you can titer for are you're somewhat limited. So you can titer for Eastern encephalitis, Western encephalitis, Venezuelan, and West Nile, and that's all one blood draw or one tube, and it goes to one lab, and that one's about 100. And then the other one that you can titer for is rabies, and I think that one, I think we're charging like 120 for a rabies titer. So if you decided you wanted to not wait to vaccinate and you want to do titers, you're looking at $250, something like that, instead of doing those vaccines. So it would certainly be cheaper to do the vaccines than it is to pull the titers. I have a few people where we feel pretty comfortable that we can maybe do titers every other year instead of every year. And so I think it balances out if you do that, right? You're probably, if your titers show that you're protective and you haven't paid for vaccines for 2 years, it kind of balances out to about what you would pay for the vaccines. Or I have some people where maybe we'll do the rabies titer 1 year along with a 3-way. And if the rabies titer is good, then the next year we come back and we skip the rabies and do the encephalitis titer, just to spread out the cost. So we try to do different things if we want to see what we can do. So that's how I do it, is try to balance the economics versus the risk to the horse. Most of the time, if I'm doing titers, it's older horses or horses that have maybe chronic Lyme, or they have, maybe they have allergies, or they have vaccine reactions, or they have COPD and heaves. I'm worried about something that might be a problem for them that over vaccination might stimulate. So that's when I'm usually, having the conversation with someone, is when I'm worried about that. So that's kind of how we start. So if you want to do the rabies titer, it goes off to Kansas. They're the only place in the country that does rabies titers, and they do all the titers for all species. So they do human titers, they do dog and cat titers for import and export, they do horses. So what you get from them is you get a guideline that just says, according to the World Health Organization, this titer is protective for animal imports and for humans. So they don't want to say, yes, this is protective for horses, but I think that we can pretty safely assume that that same value that is protective for other species is protective for horses. So the guidelines for vaccination for rabies are every year. And that's because that's what it says on the bottle. So I think what we need to think about there is that it's probably not cost effective necessarily for a pharmaceutical company to pull that trial out and test it at 3 years or 5 years. If they have a label claim that says 1 year and people are willing to vaccinate every year, I think that the funding isn't really there for further studies. So that's part of why we vaccinate every year, is that that's what's on the label. But I see titers that are protective at greater than 0.5 for at least 5 years, if not longer. So I feel pretty comfortable a lot of times if I get a positive titer, I will wait and retest them every couple of years and then vaccinate if that titer drops below 0.5. Or if I have an older horse and we're wondering if we should vaccinate and it comes back low, then I feel like absolutely I should vaccinate, and we go and vaccinate. So I think it kind of helps you make those decisions where you know that it's time to vaccinate or not. So does anyone have any questions on this page? We good?
Yeah, I think we covered it pretty well.
Okay.
You covered it pretty well.
Got it. Okay, so then the next two on here are tetanus and West Nile. The tetanus one is the one that we kind of struggle with. So if you look at the handout that I'm giving you guys, it's the AAP handout says that there is a titer that you can run at Cornell. Cornell has no idea where they got information like that. Whenever I call Cornell and say, it's on the paper, can I please get tetanus titers? They tell me I'm crazy. So there's no place in the US that we can actually get a titer for tetanus. The speculated length of titer, length of protection from a vaccine that the AAP is willing to give you on that sheet is 2 to 8 years. And we know that in people, you get a tetanus shot every 10 years because it lasts that long. So I think that we can assume that, yes, it probably lasts a while. The problem with tetanus, like we were talking about earlier, is that it's endemic to the environment. So it's everywhere. And so they're going to be exposed a lot, right? So we don't want them to get a puncture wound and not have an adequate tetanus titer. So since I can't titer for it, I vaccinate for it at least every 3 years. And then West Nile, again, we were talking about with that other test. It's the same serology, the same titer test as for the encephalitis. So if it comes back and it's positive, then you don't need to vaccinate. Once we get to Potomac horse fever and botulism, we don't have any titers for any of these other vaccines. So when you're talking about these vaccines, it truly is a question of, are you at risk in your environment? And then do the pros of the vaccine outweigh the cons? So if your horse is not at risk for an adverse reaction, you don't see any reason that he's too stressed to be able to handle it, and you definitely think it's in your environment, then these guys can be worthwhile. I don't do as much Potomac as I used to, just because I really haven't seen that many cases in my area. But if I know that somebody's up by the river where they do see cases, then I'm a lot more likely to push for that vaccine than I am down in, the part of Virginia where I'm at, where we're kind of away from the area that is at most risk. So that's how I kind of decide on that one. And then we talked a little bit about flu and herpes and strangles. So I think what I would say about these diseases is it's like the common cold. It's like you getting a flu vaccine, right? So if you don't get the flu vaccine, you might get flu. You'll probably feel yucky for a couple days. You might run a fever. You might have a snotty nose, but you'll probably be okay afterwards. So the risk is more of can you handle that? Like if your horse were sick for a few days, would you be able to, give, Banamine and make sure that he drank adequately and keep an eye on it and handle that sort of disease process? Or are you more comfortable with trying to minimize that? If your horses never go anywhere, they're a lot less likely to be exposed to any of these. So if you have 2 old horses and they sit in their pasture and they don't ever nose any other horses, I think that vaccinating for flu or a rhino or for strangles is probably overkill. So these particular vaccines are ones that I do in my show population, unless there's a reason why that horse shouldn't be vaccinated for it. I don't do strangles very often at all. That's just for my flu rhino. And then I save strangles and give it if the horse is living in a barn where we know we have shedding or we know we have active infection. Sometimes vaccinating ahead of time can prevent the other horses in that barn from getting the disease. So I just use it in those cases, and I don't vaccinate for strangles otherwise because I'm worried about the vaccine risk. So we talked about how you can get that systemic reaction if they have a titer to strangles. There's also some literature saying that giving the intranasal vaccine for strangles when giving any other vaccines can cause abscessing, and that the intramuscular strangles vaccine may cause abscessing and may not be very effective. So, there's a lot of pros and cons to that strangles vaccine. Does anyone have any questions? We're good?
Yep.
All right. And then we go to these other ones that are kind of rare. So I guess what I would say with the Lyme and the EVA and the lepto is they're very specific to the risk of disease for your horse. For me, with Lyme in our area, we have a lot of tick-borne disease in Northern Virginia. We have a lot of woods. We have a lot of people that travel and trail. They're going in and out of the woods and up and down the hills, and so all of these horses are covered in ticks. The way the vaccine for Lyme was explained to me is that it might prevent new infection, but it doesn't prevent chronic infection from flaring. And I have had a few cases where the horses have gotten worse when I vaccinate them for Lyme if they already have had Lyme in the past. So I tend to use it more now for horses that get it every year and I know have not had Lyme, or horses that are new to the area, to maybe protect them a bit while they're getting used to living in Virginia. But I don't give it to everybody. I used to give it twice a year, and now I tend to give it in the fall only. And I feel like I still get that titer that lasts. So you can actually test for a titer for Lyme because we do all these multiplex tests for testing for Lyme. So the test will come back with a high OSPA, which is the protein on the outer surface of the Lyme organism when the tick bites the horse. So it's protecting against that new portion of the infection right when the tick is biting the horse. It doesn't protect against the other. So that's when I use it. And then we already talked about EVA. It's only in breeding populations that are at risk. And then for the lepto, you really want to be careful, always titer before using lepto, and only use it if you think you're at risk for uveitis on your farm, because vaccinating for it in a horse that already has a titer will cause uveitis and can cause blindness. So you just have to be really careful with them. All right. Any questions on that?
No, I have a question, but we haven't. I'm thinking you're probably going to cover it. Maybe.
I was going to talk about some of these words that get thrown around by alternative practitioners. So there was the term that we like to use now is vaccine associated adverse events. So it's a much more professional scientific term. What are we worried about when we vaccinate? So there's kind of 3 levels of reactions. So one would be the immediate hypersensitive reaction, hives, breathing issues, breaking out in a sweat, full-on anaphylaxis, itchiness, maybe even a fever. So those are bad. We don't want those at all. Those horses often need epinephrine, maybe just Banamine, but often a lot. The second set of reactions would be the, 1 to 2 days out. They have a fever for a couple of days after the vaccine. They might feel bad. It's like when we get the COVID shot and everybody says they're really stiff and sore and they have a headache. It lasts a couple of days, right? That's your second set of effects. And the third one is that you can have some more chronic and insidious disease processes that might be might have been started by the inflammation and the immune response from vaccines. So in dogs, they talk a lot about immune-mediated hemolytic anemia from over-vaccination. So that's something that to be concerned about with small animals. We worry sometimes about chronic gastrointestinal inflammation, muscle stiffness and soreness, maybe some triggers for autoimmune or allergic responses, from multiple exposures to vaccines over and over again. So that's kind of the mystery part of it. We can't necessarily say that that is the cause, but we do worry sometimes that it could be affecting it. There's this other term that gets thrown around sometimes called vaccinosis. And it's a term that was used a lot right around 1995, 2000, to talk about these sort of chronic, possible ailments that might be correlated with vaccines. And I think that it got a lot of flack at the time because it's really hard to prove. And a lot of what they were using as evidence was stuff that was written, in the 1800s. And so it was really hard to get behind the data they were using for this term. So most of us have kind of gotten away from using the term vaccinosis, and we want to talk more about what we know can be directly correlated with vaccines. So that's why we're calling it this vaccine-associated adverse event. And then the other thing I have down there, and I'm not a homeopath, so all I can say is I know a little bit about it, but you would need to find someone who practices it to understand it completely, is that there are some people that use homeopathic nosodes. And what it looks like is that using them in place of vaccines, there's very little evidence that can prove that they will protect your animal. So it's really hard to say for sure that if you didn't vaccinate at all and only used a nosode, that you would have protection. So I think if you were going to do that, you just need to be aware that we just don't know. But where it does seem to help sometimes is with these chronic possible vaccine-related events, that maybe using nosodes can help alleviate some of those events after vaccination. And that seems to be, more favorably looked upon, and there's more data to support that. So I think that that is certainly something that we can look at as, where do you go when you have an animal that has vaccine reactions? All right, so did I cover your question, or do you have another?
So my question is, should you split up your vaccines instead of giving them all at once and have them over a period of time?
I love that question. I think that's a great idea. So the biggest problem with that is the expense, right? Because if you're having somebody come out and administer vaccines and now they're coming out 4 times a year instead of twice a year, that can be really expensive by the time you pay for the farm calls with gas nowadays, to do that. But I do think if you can split up your vaccines and also maybe use vaccines that are not multivalent. So using vaccines that aren't 5 things in one,
right?
Which is why it might take a couple of trips to get them all done. So trying to split up, don't give one vaccine that has Eastern, Western, Tetanus, West Nile, flu, rhino, and rabies in it. You don't want it all in one. You want those to be split up into multiple doses, so that you can prevent that huge immune response at once. Yeah, I think that's actually a good idea. So if somebody could, and that's part of why I do Lyme in the fall, is trying to spread things out a little bit. So I'll do like a 4-way and a flu, rhino, and maybe rabies every other year for rabies or something in the spring. And then in the fall, I'll do my botulism and Lyme. And, if they want flu, rhino, I'll do that, but if they were going to want to do everything, including the strangles and Potomac horse fever, I would certainly need to throw in extra visits, because right. I don't like to do more than 2 or 3 vaccines per visit if I can help it. Yeah.
And so if you were in a barn where the vet was coming regularly, you could say, let's do this month, let's do that next month, and schedule it that it's appropriate for the season.
Absolutely.
Spread them out.
I think that would be perfect. Yeah. So I know another practice that there's a Potomac rabies combination vaccine. And so she uses that one, and that way she does her 3-way and her flu, rhino in the spring. And then she comes back in June and she does that Potomac rabies vaccine. And then she comes back in the fall and does her flu, rhino, and botulism, so she spread it out that way.
Right.
Into 3 visits, trying to kind of make some sense.
Yeah, because if the horses reacts to the vaccine, you don't know which one it was, but if you knew which one it was, you could then make educated decisions about that particular one because it's been split out from, instead of whacking them with everything at once.
Yeah, absolutely. Yeah, I think that makes sense. Or like most of us have a routine and where we put things, so a lot of us, anything that starts with an R goes on the right side of the horse, so that we can try to remember where we gave things. And so we'll do stuff like that so that if there was swelling, we can be like, oh, it was to the rabies vaccine, or it was to the, flu, rhino. So then, next time that that's the one that might cause a reaction.
So
Well,
Janelle,
I didn't really say it, but with flu, rhino, the duration of those vaccines is really only 6 to 9 months. So part of the reason we don't titer for them is that by the time you got a titer, it wouldn't last long enough to be worth titering, so that's why that one just gets given every 6 to 12 months, depending on your risk.
So Janelle is asking, is there any combo that's harder on horses, not because it's too many, but just because those particular vaccines, I think, are some of them, do you see more reaction from certain vaccines?
Yeah, so the one that I think causes the most reactions is rabies. And that's just the way it is. Most of the time, if you're giving a rabies vaccine, the majority of the rabies vaccines are 2 mils versus 1 mil. And that might be part of it, but they are very reactive. Merck made a rabies vaccine that's been out about 5 years now called Equirab, which is supposed to have a lot less reactions. And I really like it for that reason. So that's the one I use in my practice. But everybody uses different ones. And, I think in small animal, they actually have 2 vaccines out that are made by a different company that are the only ones that are thimerosal free, which is another thing I'm not really going to touch on too much, but a lot of these vaccines contain mercury. So if you're giving them every year, you're adding to the heavy metal burden that your horse has in his body. So with small animals, they're trying to come up with some solutions for that include mercury-free vaccines. So that's another thing to think about. If you're worried about that, it's another possibility. But yeah, rabies is definitely the one that I think causes the most reactions. And that's why I think it's great that we can titer for it.
Right. And so the kind of going back to your beginning of talking about a wellness plan, it's not just about getting the vaccines for your horse, but it's also having you look at the horse to see, how did he come through the winter? How is his weight? Is there any issue that's cropped up since, especially winter around here.
Yeah, right.
And so, and I've been talking to some vets recently, and it's, if you have a really good relationship with your vet and then you have a problem, they're much more willing to come out at midnight to deal with you in the snow and the freezing rain than if you, only call them once a year to, do something and then don't have a relationship with your vet. In other words, the job's tough. It's hard enough. Right.
Yeah.
The more I talk to vets, the more I realize that there are many pressures from lots of different directions now. It's not just the hours, it's the cost of education, it's the gas prices, it's the, finding a practice, it's all these other things. And so maintaining a good relationship with your vet is like a number one thing for you, because if and when you need to make that call, you want them to say yes.
I think that is very true, that you want it to be a relationship, not just, vaccines. But I think for a lot of practice, it has become, I only come out to do your emergencies if I do your vaccines, right? I think that the other option would be to say, I don't need you to do my vaccines, but I sure want you to come out and do foot x-rays twice a year. And can you come out and look at their teeth? And can we have these discussions? And can you do blood work? And I think it's about having that relationship. So if you can find a way to create the relationship, then you don't need it to be because they did your vaccines, they're now required to come out and do your emergencies. Absolutely. I think that would be a way better way to go.
Right.
And then they know the horses too. It's not just that they walked in the stall once and put a needle in the horse. They know, what the horse is eating, and they know how you take care of them, and they know who their buddies are, and they know whether you're putting them out on grass, and they know what your concerns are. I think that would just be a way better way to go.
Yeah.
Mhm.
With horses that are PPID or insulin resistant, do you have to be more careful with vaccines?
Absolutely. Yeah. And I kind of have a little bit on that, but I'm just going to switch over to those slides anyway, because I know we're while we're talking. So let me do that, and then we can talk about that. But I do think that for horses that have PPID or insulin resistance, they're a lot more pro-inflammatory. So they're much more likely to have inflammation in their body to begin with. And their immune system isn't functioning normally. So when you go to vaccinate them, they may or may not respond to the vaccine. And if
And
they
Dr.
do
Hancock, is
respond,
this a whole nother webinar that we need to have, is understanding laminitis risk and nutrition?
well, I'm just gonna like quickly go through 2 or 3 things, and we can go back and do this some other time.
I think it would be, yeah, we would do a disservice looking at what you already popped up there to just hit it really briefly, but let's do the vaccine part of it today and then come back and talk about the other parts of it, because it looks like you've got a great presentation here and I would hate to short circuit it, right?
Right, but well, that's why I was like, let me just go over this stuff real quick. So what I do find is that they have increased inflammation in their body, and they can have what happens a lot of times with these insulin dysregulation horses is that they have the insulin is high because they already have elevated inflammation in their gut, and their liver isn't functioning normally. So that means they're not filtering things as well as they should be, and they're not responding to immune problems the way they should be. So all it takes is another inflammatory event for them to then get even worse for whatever reason, however that might be reflected. For some of them, that might mean that they have an even harder time shedding weight. For others, it might be that they actually do have some sort of laminitic event. For others, it could be that their GI tract, maybe they have more problems with absorption, after something like vaccine. So I think it's hard because there's so many things involved in what's going on with their endocrine system that a lot of them can't handle the vaccines appropriately, whether that's not responding to them at all or responding in a way that is like too much of a response. I think you get both. So I think that, yeah, this is my older, at-risk group that I really do like to titer as much as possible to kind of minimize the risk. This is definitely the group that I do that the most with. And I mean, when you're talking about horses that have insulin resistance and metabolic problems, they're usually at least 18 to 20 or older. And they were probably if people are really caring about them, they've probably been shown or ridden and done all kinds of stuff in their life up to that point. So they've probably been vaccinated every year and taken all over the place. And, they've probably gotten everything you can imagine. So the chances of them having a robust titer are pretty high just because of how they've lived their life up to that point. Yeah.
Great. My other question is, there's been some conversation about the association between head shaker syndrome and over vaccinating horses. How do you feel about that?
Okay. Well, that's a good one. So my take on head shakers is going to be a little different because I think a lot of it can be fixed if we can change the whatever's stimulating the vagus nerve. So for me as an osteopath, I have a lot of success with most of head shaking just by fixing the pole problems. So if I can get the TMJ and the pole adjusted and do some craniosacral work and then kind of focus on getting the balance, I can make a lot of head shakers better just from doing that. And so then I would say, like, along with that, if you would then address the immune system, you probably make a lot of them better. But let's say you have a horse where you're never going to do those adjustments and they have an overstimulation. I think then in those cases, the vaccines would absolutely be one more thing that could cause hypersensitivity of the immune system. So I've just been reading a lot about medicinal mushrooms. And one of the ones that they're talking about that's supposed to be Really good for hypersensitivity is reishi mushrooms. So
Oh,
I
yeah.
almost wonder if that's something you should consider with those hypersensitive head shakers, is throwing them on something like reishi and see if that might be something that would help them kind of tone down their responses.
And again, that's another topic that I think we could probably spend a fair amount of time on. And it's one that it's really frustrating if you have a horse that's a head shaker and if you don't know where to look for a solution, it can be a huge problem, right? And I think that there's a gamut on it too.
Oh yeah. Well,
Making notes for future webinars. That's what I'm doing.
Right. I know it's a safety issue too. I think that's what, for a lot of people, it becomes something where they don't feel safe riding, they don't know what's coming at them next. And the horses are, all over the place. So yeah, that's definitely one of the problems.
Yeah.
Okay. Well, then I'm not going to go further on this set of slides, and we'll save this for some other time.
Yes.
Just real quick, since it is spring, for those of you guys that have grass, please be careful the next month or two. Remember that first set of grass after a drought or a cold period is where you have a lot of starch in the first bit that comes out of the ground. So if you have a horse that's at risk, this is the time to be worried. So just be careful with them. Make sure you're limiting their time, especially late in the day. So as we have warm days and cold nights, then the grasses are producing starch during the day. So the worst time for them to eat the grass on, kind of these temperate days is at like 5 o'clock at night. So you kind of want them off the grass in that late afternoon, evening period. And the best time for them to be on the grass is, more in the early morning period, so say 7 a.m. to noon, something like that would be.
Maybe we need to schedule that webinar fairly soon, because this whole thing about grass, there was a chart that ran around Facebook talking about the amounts of sugars in the grass at the different lengths and things. And we are in that season. So maybe we can get you back fairly quickly to talk about this one, because we've kind of hit an hour and I think we've covered the vaccines, and this is a whole kettle of fish in itself.
I totally agree. So we can definitely do that. If you guys have interest, I can definitely do that.
Oh yeah, we have interest for sure. All right. So I think we'll just wrap this one up. Thank you so much. So Janelle saying I have to leave, but thank you so much for the webinar and for the resource materials. Yep. And we will post those resource materials when we post it on Facebook so that you have those links. I think I can't put the PDFs into the YouTube thing, but we'll put it over there. I might just put them up on my website. I have a section where I put up free downloads. So maybe I can stick them up there. And
that sounds perfect.
Great. Well, this is fantastic. I so enjoy talking to you, and it's really great information. And we have at least 2 more, maybe 3 more topics. So it's really
we're all set.
And I really appreciate it. And when you do 3, you get your own playlist. Okay. So
I think you can definitely manage 3.
Oh yeah. All right, everybody. Thanks so much for tuning in. Just remember, we have Sharon Wilsey on Thursday at 1 o'clock with our continuing conversations. Who knows where we're going to go? We never know till we get there. It's always really fun. And thank you again, Dr. Hancock. This has been great.
All right. You guys take care.
Take care. Bye.
Bye.